Welcome back to Medical Matters. I'm Andrea Wehrman. The need for trauma care in Georgia is an ongoing struggle for today's healthcare systems. What you may not know is that not every hospital has a designated trauma center. In fact, only 15 centers serve all of Georgia, Gwinnett Medical Center being one of them. Let's take a look at how GMC is supporting an effort to expand trauma centers statewide.
Georgians are 4 times more likely to die from a trauma due to poor access and limited care. Not every hospital has a trauma center, and that means your chance of survival is at a greater risk.
It's extremely important that we organize a statewide trauma system to really impact the lives of people. If we do not organize ourselves, this could lead to more death in the Georgia area.
Gwinnett Medical Center is a Level 2 trauma center, which means 2 things. 1, a coordinated effort of care among several specialties is provided, and 2, a trauma surgeon is on call 24 hours a day. A recent case addresses the near-death experience of one patient.
This is a young 22-year-old male who was apparently working out with an industrial lawnmower and apparently was strapped for 3 hours when it crashed and landed over him.
When the paramedics arrived at GMC with the patient, he was in a state of emergent shock. His muscles were deteriorating and his kidney began to fail.
When the patient presented here, in a coordinated trauma system, the emergency room physician had the first line. And they evaluate the patient, and then they call the trauma surgeons who come in to help out. And when we come in to evaluate the patient, then the patient is elevated to the higher level of care.
The ER physician, Dr. Carlton Buchanan, saw the need for immediate trauma care, and the patient survived an otherwise deathly accident.
It is extremely imperative that this is for all of our good, basically, that we get organized and have a well-organized trauma system in place. This could benefit not only us, but the future of our whole communities.
The key for expanding trauma care centers across Georgia is funding and government support. If Georgia's death rate improved to the national average, over 700 lives could be saved a year. To find out more on supporting this initiative, please visit www.georgiaitsaboutTime.org. With me today are 2 GMC medical experts, Becky Weidler, ER specialist, and Gina Solomon, trauma coordinator. Thank you, ladies, for being here today.
Thanks for having us.
We just wanted to come out of that package and talk a little bit about the trauma and ER care provided at GMC. Just one stat is that trauma is the #1 killer of Americans ages 1 through 44. So, Gina, can you talk a little bit about what a trauma center means and what's included in that for the care?
A trauma center is a specialized center that is able to care for the most severely injured, from everything from motor vehicle crashes, falls, sports injuries. It includes a whole gamut of things. Trauma actually means anything that causes injury, and we have the support team and the resources to be able to take care of those patients.
And to most people, that probably sounds like what an ER is. And I know a lot of people out there don't understand the difference between trauma care and ER, and not all hospitals have a trauma center. So Becky, can you talk a little bit about the difference between those two?
Well, sure. All those incidents that Gina talked about, those types of patients can come to a regular ER. But what a trauma center has is the resources, and by resources we mean we have the ultrasound availability, we have the OR set up and ready to go. In the ER, nurses are specially trained to just take care of trauma patients. Trauma surgeons can easily and quickly come in. So even though most ERs can take care of those, if you are severely injured from any one of those things, the best place to get that complete package of care is at a trauma facility, and that's what we can do for you at GMC.
Mm-hmm. And GMC is a Level 2 trauma center.
That's correct.
So, Gina, what does that mean being a Level 2? There's what, levels 1 through 4?
There are levels 1 through 4. Really the difference between a level 1 and a level 2 is level 1s have to have residency programs. They do a lot more research and community outreach programs than level 2. We are able to take care of just about any trauma-related injury at our facility. But the level 1s are few and far between, so the level 2s are very important in that whole system to take care of trauma patients.
Okay. And Becky, because not all hospitals have trauma centers.
Right.
ERs do work collaboratively, just like GMCs do. And the incident with the young man who was hurt with the lawnmower, and Dr. Buchanan took care of him initially.
Sure.
Can you talk a little bit about the skill set going into the trauma care then provided by Dr. Massoud? And if that wasn't there, it could have been severely incurred by death.
Well, whenever you're looking at the patient, you actually can't just be distracted by the one injury. You have to look at the patient and that whole body. And when you're thinking about trauma, it's very easy to just get focused on what you're seeing. And on this gentleman, we couldn't actually see all the injuries that he had because they were occurring inside his body. So trauma facilities and the trauma personnel are thinking you got to take that whole body, that whole body into the picture and kind of think about what's happening underneath the skin and what you can't think of. So they were looking at urine and the output that he was doing and things like that. And that can actually, quick action can save lives. And that sounds like that's what occurred for that young man. So.
And can either one of you give some tips to families on how they can know the difference between, whether they need to find a hospital with an ER or a trauma? And usually when they do, it's pretty severe and it's last minute. So. What kind of tips can you provide to families to know where they should be?
Most ERs can take care of your routine, injuries, lacerations, those kind of things, twisted ankles. Those can be taken care of very easily at most emergency rooms. When we're talking about trauma centers, the severely injured, and most of those people do come in by our EMS service because they're unable to be brought by a car. So really, families need to think about where those trauma centers are, and especially in the state, especially when you're traveling, because there are a lack of trauma centers in our state. When you get far out, you can be more than 100 miles from any trauma center, and if you get in a serious motor vehicle crash, you want to know where they're at, because you may have to be taken far away to get there.
Sure. Well, it's unbelievable to know that there's only 15 in the state. So I know you're working with the Trauma Initiative through GHA to really promote and work on those efforts to make sure that, even though the GMC is a trauma center, we want to promote this and have more statewide. So can you talk a little bit about your role in pushing that effort forward?
There are several different committees that are meeting. The trauma coordinators throughout the state, there's 15 of us, and we do get together and meet, talk about how we can do things better. There's also the Georgia Committee for Trauma Excellence. It includes most trauma coordinators, some of the CEOs of hospitals and those kind of things, and we're all able to get together, talk about the issues that we're trying to overcome, and getting the word out to the communities to let them know that this trauma initiative is huge. It's really important. We want to save those extra 700 lives. We want to be as good as the other states out there, not lagging behind where we are now.
Sure. Is there anything else people can do at home? I know they can sign on to it'sabouttime.org, and all they really have to do is sign their name on the petition saying that they support those efforts. Is there anything else that people at home can do to make sure that
sign those e-petitions and pass the information on to friends, family members, other people? There's a lot of people out there that have been touched by trauma. You just have to sit down and have a conversation, and you realize that it's so prevalent out there. And just tell people about it. Get behind us. Support. Write your congressman. Those kind of things. Get into those things. Those are great.
Okay. Well, thank you so much, ladies, for being here and taking time out of your busy schedule at the hospital.
Thank you.
Thank you.
For more information on how Gwinnett Medical Center is planning, advancing, and transforming healthcare in Gwinnett County, please visit www.gwinnettmedicalcenter.org. On behalf of Gwinnett Medical Center, I'm Andrea Wehrman, and thanks for tuning in to Medical Matters on TV Gwinnett.